Hi, everyone. Morning. So today I'm just kind of going to be talking through my experiences as a clinical trial recipient and how I've been able to manage my mental health. So first and foremost, I think when you have when you have sickle cell disease, you're primarily focused on your physical health and not necessarily paying attention to your mental health because sickle cell is such a chronic, progressive, debilitating illness. And so your mind is just focused on, let me get out of pain, let me start to feel better. But the reality is that your mental health almost starts to take the front seat after a clinical trial, because now you're going through a period of, I know my life with sickle cell disease, and now I'm adjusting to a new life without sickle cell disease. And so a lot of patients that I've kind of spoken with within the patient community, one of the things that we all deal with and have in common is what we call survivor's guilt, which is when you work in the advocacy space, or you have been a sickle cell patient all your life, then you participate in a curative therapy. And now, even though you're well, you still have friends and maybe family that are still dealing with sickle cell disease. And it can be, you almost feel like, why did I make it through and get this chance? And they didn't. So when you're kind of going through the rows of survivor's guilt, I think it affects different people individually, but more importantly, when it comes to mental health, you kind of have to get your mind in that sense of, even though I made it, how can I turn my pain into purpose? And I think the beauty in advocacy is that even in, sitting on a panel like this and having a conversation with you guys, I'm able to feel like I'm making significant contributions to the community. And that's how I'm choosing to channel the survivor's guilt and deal with it in a more proactive, mindful, psychologically flexible process. And then another thing that we all struggle with as well is an identity crisis. And that is just the analogy I always use to explain that to people is, imagine if you've been married for 32 years. In my case, I had my transplant at 32. I'm now 35, so I'm 3 years out. If you've been married for 32 years and your last name changed, even when your husband passes, if people refer to you by your maiden name, you're not instinctively going to respond because you've had the identity of a wife with this last name for a long period of time. So I always use that analogy because it's kind of the relationship with sickle cell disease is, this is a genetic condition that you are born with. And after a while, you just adopt the persona of like, sickle cell is me. And so when you now go through a clinical trial, you're in that kind of shock phase where you're like, well, who am I outside of sickle cell? What are the things that bring me joy? What are the things that bring me fulfillment? What are my real basic values outside of this disease? And for a lot of people, I think that identity crisis, it takes the bulk of the mental health work that you have to do. I'm honored in a position where, like, because I had my curative therapy done at the NIH, I do have resources, mental health resources. And Dr. Martin here has worked very closely with my therapist, Marianne Tamula, who I want to shout out today because of the brilliant work we've been able to do within the past 3 years of really having me change and shift my mindset from, like Dr. Martin shared, she said, sometimes we're kind of stuck in a rut of sickle cell is me, and I can't see my life outside of pain, not fully realizing that, no, it's more about kind of being conscious of and observing your thoughts. So what I've practiced in my day-to-day now is, sometimes I will be in that mind frame of, I woke up this morning, my body feels like it's in pain, even though I know I have gone through a transplant. And then it starts to kind of shape how my day is going to pan out. But now I'm in a space where I'm in pain. I do what I need to do. I do my breathing exercises, which gets me to be more present with my body. And then I decide, all right, how can I arrange my day where I'm still productive, even though I'm dealing with something that will be more cumbersome, which is pain. And then what I do in that case is I kind of rearrange the goals of what I plan to achieve and just do it from the bedside. I think one of the things that we get, a lot of patients get stuck in is feeling like this is me, and I can't see myself outside of this. And sometimes you just have to shift your perspective. I'll share a personal example. So for me, for example, I work in public relations and media. And so a lot of my life, sickle cell has kind of factored into the kind of jobs that I can take because, I started as an entertainment publicist, which requires traveling and being on tour with artists. And then I started to quickly realize that sickle cell just didn't make space for the kind of lifestyle that I was leading. And then I decided, all right, let me take a step back and kind of reevaluate and figure out a way to work with my disease, but also to do things that bring me fulfillment and joy and happiness. And one of the things that Marianne taught me that has completely shifted how I think is, imagine if life is a race and everyone is on the track field. And even though at certain points in time, my health took center stage, it almost felt like I was stagnant and I hit pause in terms of like marriage and children and getting a house and getting a promotion, all of the things in life that like we're supposed to, as women and men, check off and say, I've achieved. My health kind of became the quintessential part of my life and everything else kind of fell to the back burner. And then she kind of changed my mindset and said, if you think about it, like if we're all in the track field that people are running, you're sitting in the bleachers, but what you're doing is you're strategizing. You're watching where people are making mistakes. You're seeing them on the track field fall. And by observing, you won't be you learn from their mistakes and you won't be in a position so that when you do hit that track, you kind of already know how to best navigate it because you've taken this time for pause. And pause can represent different things for different people. Pause for me represents either taking some time to practice self-care so that I'm well equipped to handle whatever life throws my way. And of course, in the analogy of like a track field is while I'm sitting in the bleachers, I'm strategizing and planning and observing my peers, but that doesn't necessarily mean the work stops. It just means I'm preparing so that I'm in a better position to win the race when I do get on the track. And I think for a lot of people who have been through a clinical trial, I will always say this. Yes, your physical health is significantly impacted by your disease, but so is your mental health. When we go through bouts of a pain crisis and we're on admission, you have periods where you just feel emotionally low, and then you start to isolate yourself from everyone because you don't necessarily want to be seen as a burden. But the reality is that I think we have different people in our lives that are there to either motivate us or to help us kind of get out of that like mental state rut. And for clinical trial recipients, I will say, if the recovery is 60% physical, it's also 40% mental, because you really have to psych yourself out and tell your body that like, I no longer have sickle cell. So what were my triggers before? They might be my trigger now, but because I know I don't have enough sickled red blood cells to cause a crisis, you then have to do the mental hard work of trying to unlearn certain habits that you had in the past. And for me, I think in making sure that my mental health is in a really good place, I have turned to advocacy. And what advocacy has brought me is the opportunity to form a sickle cell tribe, to meet people who are just like me in the patient community, whether they're on the other side and navigating a like life after a transplant, or whether they're on the other side, which is still dealing with sickle cell disease. I think finding my tribe and turning my pain into purpose has put me in a position now where I feel like I'm creating impact. And I remember the very first day I had my first therapy session, the first question she asked me was like, what are your values? What is important to you? And in determining those things, everything I'm doing now is kind of getting me to the end goal, which is I know my legacy when I live this world. It might not necessarily impact me or this generation, but the younger generation of patients that are growing up will have us as kind of their foundation. It's kind of like in the Black community, how we say we're riding on the backs of the ancestors. My hope and goal is that within the sickle cell space, in all of the advocacy work, that this will be kind of a stepping point for all the generations of children to be born who are going to navigate this space. So that's just a short summary. I tried to be as succinct as possible of kind of my patient experience, but yes, feel free to ask me and Dr. Martin questions.
There is one question that I see, Wunmi. What kind of curative therapy did you have and when? I think you said it was about 3 years ago, but what kind, can you talk about the kind of transplant you had?
Yes. So I had a allogeneic stem cell transplant. My brother was my donor, and I had my transplant done in August of 2019.
I just want to say I really love how you talked about values there. It's something that we find again and again, is that even though with ACT therapy, we don't go in saying, I'm going to get rid of your anxiety or I'm going to get rid of your pain, because I'll tell you guys something, there is no psychologist who can do that. We just say, I'm going to help you live the best life you can live while you have pain, right? Or anxiety or sadness, whatever it is. And what we find is that when people connect with their values, whether it's through advocacy or whatever else, that they then report, the more I connect with my values, the less I really think about my pain, right? Or the less I feel anxious. It's not what we're trying to do, but it's kind of like a nice side effect of it. So I love how you illustrated that really nicely.
Thank you.